Hello, today I'm going to talk all things sleep. Now, we see a hell of a lot of people that have unrefreshing sleep, and I would say that most people in their lives, in fact, actually I'd say everyone in their lives has problems with sleep. So today we're going to go through all the different sleep disorders, how to figure out whether you have a sleep disorder, whether your sleep is unrefreshing because it's related to a chronic health problem, or whether you're like many of the population that just have problems with sleep and how to actually work through that. So my name's Nathan from Active Health Clinic, and we see hundreds of people and thousands of people with sleep disorders. So first of all, it's something that we need to break it down into obstructive sleep apneas and central sleep disorders. And then we've got the more unrefreshing sleep that's with chronic health, and then I think we have just general problems with sleep. So first of all, obstructive sleep apnea is when we actually stop breathing in the night. Now, this might sound pretty shocking that we actually stop breathing. However, all of us actually do this through the night. It's just the amount of times it actually happens. Now, obstructive sleep apnea can be caused by many things, and often we talk about people that are obese or overweight, and I think that's unfairly put out there because other people can sometimes have small esophagus or windpipes. Some medications can actually cause a laxicity in our windpipe as well, and then that means that we actually stop breathing. It can happen more so when we're on our back and less so on our side, but it can also still happen in that time as well. Now, when we stop breathing, we'll often find that we'll be gasping, or we might wake up going, and so sometimes if you have someone sleeping next to you, they may notice this happen, but they also may not notice this happen as well. And the only way to really have this diagnosed is to have an overnight sleep study. So these are generally done at hospitals, but also you can now take home sleep equipment and have that done at home. It's sometimes not the most natural thing where you'll have lots of wires coming off and plugged onto you to look at your movement and your brain waves, as well as your breathing too. And by doing this can basically help us understand how many times you stop breathing throughout the night. Now, if you are diagnosed with OSA or obstructive sleep apnea, then there's a couple of different treatments. So sometimes it might not be significant enough, and that's okay. But other times we have what is called CPAP, which is a mask that we put over our faces and we sleep with, and it pushes just air into the mouth and nose, and it makes sure that we continue to breathe. The second option is having a mouth splint. So this is a big mouth guard, really stickly, that just keeps your mouth open. Now, what option is the best option? Well, that's something that you will talk about with your sleep physician. And if you have any questions about sleep physicians, then please do ask. We know a lot of great people around town. So often untreated, obstructive sleep apnea can lead to fatigue. It can also lead to other symptoms and cognitive problems, and can have a lot of overlap with different fatigue syndromes. So it's something that's really important for us to exclude. And if you have any concerns, speak to your GP, your sleep physician, or reach out to us. Now, the second condition that we see quite a bit actually is central sleep disorders. Now, central sleep disorders is where the body basically does not refresh itself. Now, when obstructive sleep apnea, we stop breathing, and that's the pathology behind that. When we have a central sleep disorder, basically the body is not refreshing itself. So there's a missing link that means that our sleep drive doesn't really refresh, or our sleep doesn't refresh us. Now, there's lots of different types of this. So narcolepsy is one of the more common, with or without cataplexy. And cataplexy is if we have strong emotions, we can tend to feel sleepy. And people with narcolepsy, or the other name is idiopathic hypersomnia, and that's idiopathic means we don't know, hypersomnia while you sleep lots, which sometimes isn't the most helpful thing. But again, it's not a bad name. But basically this test means that we'll fall asleep. Now, people don't literally just drop. That's Hollywood, that's the movies. If you put someone in a quiet environment where you are, maybe a dark room and a nice pillow, or on a plane, or maybe even a train, that they're more likely to fall asleep. And this is usually in less than 10 minutes. So the diagnosis of this, some of these central sleep disorders can be diagnosed or partly through an overnight study, but most of them are through a sleep latency test. And this means that you basically have a normal night's sleep and you go to sleep the next day. And say if you wake at 8 a.m., then they usually do it at 10, 11, 12, and 1. And if you fall asleep on average in less than 10 minutes and get into REM sleep, then that's a positive diagnosis. Now, some people go, but I fall asleep really quickly. And look, I'm quite fortunate that at night, I'm probably 5 minutes and I'm off, much to the frustration of sometimes people around me and others. But I can't fall asleep during the day. So I can do that at nighttime, but I can't do that in the day. So if you feel that you could fall asleep very quickly after a normal night's sleep, then this may be an indication that you have a hypersomnia disorder underneath, and it's a great idea to reach out to your health team, again, whether it be your GP, reach out to us, or even a sleep physician. Now, with these conditions, if they're left untreated for a prolonged period of time, they actually can be predisposing to other health conditions. Now, this could include cardiovascular disease, but also fatigue syndromes and pain syndromes. Because there's such a chronic stress, then the body basically just falls into a rhythm where it becomes a little bit overprotective and we get those other symptoms. Now, again, it's important to reach out, and sometimes people go to sleep physicians, have the appropriate treatment, and they'll feel fantastic, and that is great. And other times, often they hear that, well, you should feel better. And that's very much a time to reach out and talk about a fatigue syndrome such as ME/CFS or chronic fatigue syndrome, or fibromyalgia or other pain syndromes. And if in doubt, again, put your hand up. We're always more than happy to have a chat. Now, the next step, if we sort of go, well, let's actually pretend that you don't have obstructive sleep apnea or a central sleep disorder, and hopefully we don't have to pretend and you actually don't have it. But we wanted to then talk about what are the sort of the three things that can lead to poor quality sleep. Now, these three things actually break into four larger ones, and we'll come to that in a moment. But our physiology is one of the biggest things that will actually contribute to poor quality sleep, especially within chronic health conditions such as pain, orthostatic intolerance, POTS, fatigue. And so understanding the three parts being circadian rhythm, your sleep drive, and wake drive is very important. So your circadian rhythm is basically the time that you go to sleep and you wake up. And this is regulated by melatonin and serotonin, and some people take melatonin as a supplement. Now, saying that, it's very important that you talk about this with your doctor or pharmacist to find the right level for you and if it is appropriate for you to begin with. Now, with our physiology, so we've gone through the circadian rhythm. The next thing is actually then talking about our sleep drive. Now, this is how much our body wants to get to sleep. And it's something that in the central sleep disorders, like narcolepsy we were talking about before, that this is broken. This is not working. And at this point, we need to look at management of that. And there sometimes can be medications and stimulants. It really is dependent on each individual. But again, please always speak with your health team. Generally, we find with chronic fatigue syndrome or ME or POTS and OI that this is not the major problem. In fact, wake drive is the major problem. Now, this sometimes sounds like a bit of a strange one to say wake drive, but I'm always feel like I'm so tired and I'm so fatigued. I don't get why that's the case. But when we think of wake drive, think about it as your body wanting to be awake. So sometimes I say it's like having 10 cups of coffee and trying to sleep. It just basically isn't going to happen. And when we have a chronic stress such as pain or fatigue or OI or POTS on our body, then it actually makes it harder for us to get into our deeper sleep and stay there for longer. So instead of having this nice sort of deep sleep and being down the bottom here, we have much more of a high frequency sleep, which means that it's not going to be as refreshing. Now, that's the physiology, but I think what's really important here at the moment, and we hear quite a lot, is that if only I could get my sleep right, then I'd be fine. And to a certain extent, that is true, but it's not about working on your sleep per se, it's about working on what leads to that poor quality sleep. So if we can manage your fatigue better, we can look at your pain or your POTS or your OI, we know that you will then lead to having better quality sleep, because your sleep is an effect of other things. And in some ways, we often say that where people are complaining, saying, I just can't sleep, to me, it's like saying that, or the analogy that I don't have any money, and saying, but okay, where did you spend that? Because there's things that contribute towards this. And very much with our sleep, we need to look at the other factors, which is the next step, and talking about the other 3 factors. So we've just talked about physiology. The next thing is thoughts. Now, thoughts are something that can interrupt our ability to get to sleep, as well as stay asleep as well. Now, a lot of people instantly go to worry at this time, and in fact, sometimes it can be excitement. I know if I need to be on a plane, which at the moment hasn't been for a while, that I often will not have the best quality sleep going to, or trying to get to sleep, but then also in the night. And I might even wake early going, have I slept through my alarm? So these thoughts can actually lead to a poorer quality of sleep as well. So obviously managing these thoughts is really key. And again, there's lots of different strategies that we've gone through in different videos, such as controllables, uncontrollables, face, or just recognizing that that's actually the case. Now, the next one is our behaviors. Now, this is what we do in preparation for bed and throughout the day. And this can often be called sleep hygiene, which is just a simple way of saying clean sleep habits. Now, I'm not a massive fan of that term, but our behavior is different for everyone. And often when people have trouble with sleep, they probably go a little bit too far and saying, I have to have a completely blacked out room. I can't have any noise. I've got to have this music on. The temperature has to be exactly 21.2. And these things actually become a bit of a stress. So I'd actually encourage people to keep it as simple as possible. There's no exact right or wrong with this, but find your behavior, which could be putting on your pajamas, cleaning your teeth and going to bed. It really works out as a different thing for each person. Be aware of being on your phones and things like this. Blocking the blue light is very important, because goes back to that rhythm and the physiology. But I think if it helps you wind down, great. But if it gets you thinking, then probably not the best thing there. And as you can see, that as we're talking about these, we're going back through the categories and how they relate to each other as well. So the phone can increase thoughts, but also can change physiology in that circadian rhythm. Now, the final one of these is environment. And this is simple things like, is there a dog barking? Is it hot? Is it cold? Is there someone snoring next to you? So trying to manage these is really important. But generally, if we have a poorer night's sleep, I can guarantee that it comes back to either a change in your physiology, being your circadian rhythm, wake drive or sleep drive, or it could be your thoughts, behavior, or environment. So there's a lot of information in there. Please feel free to maybe post below what you found helpful or other parts of this. But remember that the quality of your sleep is an effect of other things. So let's go back and look at those 4 factors, work through it in the best way so that we can all get better night's sleep, or at least accept where we are at the moment and that our sleep is refreshing. So thank you for listening. Please share this if you can, so that others can have better night's sleep as well. Thank you.